Hey everyone, and welcome to another deep dive into some seriously essential nursing knowledge. Today, we're tackling a topic that might not be the most glamorous, but trust me, it's absolutely fundamental to your practice as nurses. We're talking about bowel elimination.
Yep, that's right. We're going to get up close and personal with the GI tract and all its wonders.
You know, they say what goes in must come out. And as nurses, we need to know how to make sure that process is as smooth and comfortable as possible for our patients. So we've got some excerpts from our trusty medical textbook and some nursing care plans to guide us today.
That's right. Really practical stuff you'll be using every day.
Exactly. Our mission today is to break down everything you need to know about how the GI system works, what can go wrong with bowel elimination, and most importantly, what we as nurses can do to help our patients. Are you ready to dive in?
Absolutely.
All right, let's start with the basics. A quick tour of the GI tract from start to finish. Mouth, stomach, intestines, the whole shebang. But, we don't have to go into every tiny detail. What are the key highlights for us as nurses?
Well, you're right. We don't need a full anatomy lesson here. But it's helpful to remember the big picture. Digestion starts in the mouth, of course. Then food travels down to the stomach, where it's churned up and mixed with all those gastric juices. From there, it moves into the small intestine. That's where most of the nutrients get absorbed into the bloodstream. But when it comes to bowel elimination, the real star of the show is the large intestine, or as you might know it, the colon.
Okay, so the small intestine is where we absorb all the good stuff.
Yeah.
And then the colon's job is to deal with the leftovers.
Exactly. It takes that indigestible matter, absorbs water from it, and turns it into what we know as stool.
So it's like a waste processing plant.
You could say that.
Yeah.
The colon is also responsible for propelling that stool towards the rectum and eventually out of the body.
So how does it actually do that? Is it just gravity doing its thing?
It's a lot more complex than that. There's this intricate interplay between muscles and nerves in your gut. The parasympathetic nervous system is a key player here. It stimulates those wave-like muscle contractions that we call peristalsis, and those contractions propel the waste along.
So it's like squeezing a tube of toothpaste.
That's a great analogy.
You know that feeling you get after a big meal? That
Yeah.
sudden urge to go to the bathroom. Is that my parasympathetic nervous system in action?
Exactly. It's called mass peristalsis, and it's triggered by the gastrocolic reflex. Basically, your stomach is sending a signal to your colon saying, hey, make some room, more food's on the way.
Wow. Our bodies are amazing. But before we get too carried away with our poop talk, there's an important nurse consideration that comes to mind. You know how some patients bear down really hard when they're constipated?
Oh, you're talking about the Valsalva maneuver.
Yes, exactly.
That's a crucial point for nurses to be aware of. When patients strain like that, they can actually decrease blood flow back to the heart, which can affect cardiac output. This is especially important to keep in mind when we're caring for patients with cardiovascular problems.
So gentle reminders about avoiding excessive straining are a must. Now let's talk about all the different factors that can influence a person's bowel elimination patterns. I'm guessing there's no one-size-fits-all when it comes to normal.
You're absolutely right. Everyone's different, and individual patterns are key. Age is a major factor, as you can imagine. Infants have no control over their bowels, and it's a gradual process of gaining control as they develop.
Right, toilet training. That reminds me, it's so important to be mindful of cultural differences in how families approach toilet training. Some cultures start much earlier than others, and we need to be sensitive to those variations.
Absolutely. And speaking of daily patterns, it's important to remember that ignoring the urge to defecate can lead to constipation.
It's like a vicious cycle.
Exactly. And the longer stool sits in the colon, the more water gets absorbed, leading to those hard, difficult-to-pass stools.
And I imagine this is a common problem for hospitalized patients.
It definitely is. They might be in an unfamiliar environment, feeling self-conscious, or maybe they're just not able to get to the bathroom easily.
So diet and exercise play a big role here too, right?
Absolutely. We all know that fiber adds bulk to the stool, and fluids help keep things moving smoothly.
It's like adding lubrication to that digestive conveyor belt.
Exactly.
And staying active helps keep those intestinal muscles toned and ready to go. But what about when there are underlying health issues involved?
Right. Various pathological conditions can definitely affect bowel elimination. For example, cystic fibrosis, a genetic disorder that affects the lungs and digestive system, can lead to frequent bulky stools that are often greasy and foul-smelling.
And on the medication front, we can't forget about opioids.
Oh, absolutely. Opioids are notorious for slowing down gut motility and causing constipation.
So we need to be really proactive about anticipating and addressing constipation as a potential side effect of opioid use.
Exactly.
Okay, so we've talked about the journey of food through the digestive system. the amazing symphony of muscles and nerves that make it all happen,
Yeah.
and some of the factors that can disrupt that delicate balance.
That's right.
But now I'm curious about the assessment part. How do we actually figure out what's going on with the patient's bowel elimination?
Well, a thorough nursing history is crucial. We need to ask the right questions to understand their normal bowel habits. Any changes they've noticed?
Mm-hmm.
And any factors that might be contributing to their current situation?
It sounds like detective work.
In a way, it is.
We're gathering clues to piece together the puzzle of what's happening in their gut.
Exactly.
So where do we even begin?
Well, one of the most important things is to understand their typical bowel patterns. How often do they usually go? What's the consistency of their stool? Have they noticed any recent changes? We also want to know about their diet, fluid intake, exercise habits,
Mm-hmm.
and any medications they're taking.
All those pieces of the puzzle.
Exactly.
And then, of course, we have the physical assessment.
Right.
What are we looking for when we examine a patient's abdomen?
Well, we'll start by inspecting the abdomen for any visible signs, things like distension, scars from previous surgeries, or any unusual masses, and then we'll use a stethoscope to listen for bowel sounds. Those sounds can tell us a lot about what's going on inside.
Bowel sounds. What are we actually listening for?
We're listening for those rumbling sounds that indicate peristalsis is happening. In a healthy individual, you should hear those sounds every 5 to 15 seconds or so.
So if we don't hear anything, that's a problem.
It could be. It might signal a condition like paralytic ileus, where the intestines have temporarily stopped working.
And what about really loud or frequent bowel sounds?
Well, those could indicate something like diarrhea or gastroenteritis. It's all about interpreting those sounds within the context of the patient's overall clinical picture.
Wow, I never realized how much information we can gather just by listening to someone's belly.
It's amazing, isn't it? And depending on the patient's situation, we might also perform a rectal exam to check for any masses or bleeding.
So assessing bowel elimination is a pretty thorough process.
It definitely is. And it's an essential part of providing comprehensive nursing care. But remember, it's just the first step. Once we have a clear understanding of the patient's situation, we can start developing a plan of care that's tailored to their individual needs.
All right, so stay tuned, everyone, because in the next part of our deep dive, we're going to be putting all this knowledge into action and exploring the specific interventions that nurses can use to help their patients achieve optimal bowel function.
I can't wait.
Me neither.
Welcome back to our deep dive into bowel elimination.
So we've laid some important groundwork, but now I'm really ready to get into the nitty-gritty of what we as nurses can actually do to help our patients.
Absolutely. That's where the real learning begins, applying our knowledge to real-world scenarios.
Exactly. And speaking of real-world scenarios, we talked about how medications can really impact bowel function. Let's delve a bit deeper into that, shall we?
Yeah, let's. Medications can have a surprisingly wide range of effects on the gut, both positive and negative. It's like a delicate ecosystem in there. And certain medications can really throw things off balance.
So it's not just about whether a medication causes, like constipation or diarrhea. There's more nuance to it.
Precisely. Take antibiotics, for example. While they're essential for fighting infections, they can also disrupt the balance of bacteria in the gut. And this can sometimes lead to an overgrowth of, harmful bacteria causing diarrhea.
Oh, that makes sense. So as nurses, we need to be really observant and ask our patients about any changes they've noticed in their bowel habits, especially if they've recently started, like a new medication.
Couldn't agree more. We need to be really vigilant in monitoring for, both constipation and diarrhea, as either can have significant implications for patients' overall health and well-being.
And it's not just about how often someone goes to the bathroom, right? We also need to pay attention to the characteristics of the stool itself.
You're spot on. The color, consistency, shape, and even the odor of stool can offer valuable clues about what's happening in the digestive system.
I'm all ears. What kind of clues are we talking about? What should we be looking out for?
Well, for example, black, tarry stools could be a sign of bleeding in the upper GI tract. That's definitely something we want to catch early.
That sounds serious. And what about bright red blood? Is that also a cause for concern?
Absolutely. Bright red blood in the stool could indicate bleeding lower down in the colon or rectum. It's important to, differentiate between the two.
So the location of the bleeding can change the color of the blood. That's something I'll definitely keep in mind.
And then there are those pale, clay-colored stools, which could suggest a problem with bile production or flow. Again, another red flag that requires further investigation.
Okay, so we've talked about the importance of taking a good nursing history and knowing what red flags to look for in terms of stool characteristics. But what about the physical assessment itself? Can you walk us through how to actually assess a patient's abdomen?
Of course. We'll start by inspecting the abdomen, looking for any visible signs like distension, scars from previous surgeries, or any unusual masses. Then we'll move on to auscultation, which means listening to the bowel sounds using a stethoscope.
Right. We touched on that a bit earlier, but can you remind me what exactly we're listening for? How do we know if the sounds are normal or not?
Sure. We're listening for the presence and frequency of those rumbling sounds that indicate peristalsis is happening. In a healthy individual, you should hear these sounds every 5 to 15 seconds or so.
What if we don't hear anything at all? Is that, always a bad sign?
It could be. Absence of bowel sounds might signal a condition like paralytic ileus, where the intestines have temporarily stopped working. This can happen after abdominal surgery or as a side effect of certain medications.
So no bowel sounds could mean things are too quiet, and hyperactive bowel sounds could mean things are too loud. What causes those hyperactive bowel sounds?
Exactly. And hyperactive bowel sounds, as you might guess, could indicate something like diarrhea or gastroenteritis. It's all about interpreting those sounds within the context of the patient's overall clinical presentation.
This is really helpful. It's amazing how much information we can gather just by listening.
It truly is. And as you gain more experience, you'll develop a better sense of what's normal and what's not.
So we've gathered information through the nursing history, we've inspected the abdomen, and we've listened to bowel sounds. Anything else we need to do for a really comprehensive assessment?
Well, depending on the patient's situation and the findings from our initial assessment, we might also perform a digital rectal exam. This allows us to check for any masses, tenderness, or bleeding that might not be apparent otherwise.
That's, pretty intimate examination. What are some things we should keep in mind to ensure we're providing sensitive and respectful care during a rectal exam?
Absolutely. Sensitivity is key here. We always want to explain the procedure thoroughly to the patient, obtain their consent, and ensure their privacy and comfort throughout the process. We also need to use proper lubrication and be, as gentle as possible to minimize any discomfort.
It sounds like assessing bowel elimination is truly a multifaceted process, requiring both keen observation skills and a compassionate approach.
You got it. It's a combination of head and heart. And once we've gathered all this information, we can start to develop a plan of care that's tailored to the individual patient's needs.
All right, so we've sort of mastered the assessment part. Now I'm super eager to learn about the specific interventions nurses can use to address bowel elimination issues.
And that's exactly what we'll cover in the next part of our deep dive. We'll explore the nursing toolkit for promoting regular bowel function, managing constipation, and addressing other, common bowel-related challenges.
I can't wait. This is the kind of practical knowledge that will really make a difference in our practice.
Yeah.
All right, future nurses, welcome back.
Yeah.
Are you ready to put all this knowledge into action? Because in this final part of our deep dive, we're going to be tackling nursing interventions for bowel elimination.
It's time to open up that nursing toolkit and see what we've got.
I love that. So where do we even begin?
Well, I think a great place to start is with promoting regular bowel habits.
Okay, makes sense.
Yeah.
We've already talked about the importance of diet and exercise and responding to those natural urges. But what other strategies can we use, especially for patients who are struggling?
Well, positioning is key, particularly in hospital setting.
Okay.
Encouraging patients to use a bedside commode or toilet, if they're able, allows for a more natural squatting position, and that can really help things move along.
Yeah, it's funny how those primal instincts still play a role, right? Even though we have these fancy toilets now, our bodies still prefer that squat position for, optimal elimination.
It's true. And then timing can also be a factor.
Okay.
Some people find that having a warm beverage first thing in the morning helps stimulate that gastrocolic reflex we talked about.
Oh, yeah.
Gets things moving right from the start.
Ah, the power of that morning coffee. But what about those situations where these simple strategies just aren't enough? We need to be prepared for those times when things are really backed up. I'm talking about enemas.
Enemas. Yes, they're a common intervention for managing constipation, and there are actually several different types, each with a specific purpose. It's like having different tools for different jobs.
Okay, so how do we choose the right enema? Can you give us a quick rundown of, the options?
Absolutely. So let's start with cleansing enemas.
Okay.
These are used to, cleanse the rectum and lower colon, removing stool.
Makes sense.
They're often used before diagnostic procedures or surgery.
So we need a clean slate, so to speak.
Exactly.
What about when we're dealing with really stubborn hard stool? Is there a specific type of enema for that?
You're thinking of oil retention enemas. They're specifically designed to soften impacted stool. The oil helps lubricate and soften things up, making it easier to pass.
So it's like a deep conditioning treatment for the colon. I like that analogy. But before we go around giving enemas to everyone, what are some key nursing considerations we need to keep in mind?
Safety first, always. We need a clear order from the healthcare provider, and a thorough assessment of the patient's condition is crucial. We need to check their vital signs, their level of consciousness, and be aware of any contraindications to receiving an enema.
Right, we wouldn't want to give an enema to someone who's, unstable or has certain medical conditions that could make the procedure risky. What about the actual process of administering an enema? What are some best practices?
First, we need to make sure we have the correct type and amount of solution, the right equipment, and a private, comfortable setting for the patient. We also need to explain the procedure thoroughly and answer any questions they might have.
Right, it can be kind of an awkward and potentially embarrassing procedure, so putting the patient at ease is really crucial.
Absolutely. And we want to encourage them to relax as much as possible, That can make the administration and expulsion of the enema solution much smoother.
And are there any specific positions that can help with that? I vaguely remember learning about different positions for enemas.
You're right. The most common position is the left side lying position, with the knees flexed. This helps the solution flow more easily into the rectum and sigmoid colon.
And remind me, why do we avoid the Fowler's position?
Good catch. In Fowler's position, the solution might be expelled too quickly, which means it doesn't have enough time to work its magic.
Got it. So we want to give that solution plenty of time to soften things up. Now let's talk about a procedure that I imagine can be quite challenging, both for the nurse and the patient, and that's digital removal of stool.
Yeah, this is definitely a last resort intervention, used only when other methods of relieving fecal impaction haven't worked. It involves, manually removing the hardened stool from the rectum.
I can only imagine that's not the most pleasant experience for anyone involved. So what can we do to minimize discomfort and maintain the patient's dignity during this procedure?
First and foremost, we approach this procedure with sensitivity and compassion. We explain each step thoroughly and provide reassurance throughout. Proper lubrication is essential, and we work slowly and gently to avoid causing any pain or injury.
And monitoring the patient's vital signs is crucial during this procedure, I imagine.
Absolutely. We need to watch for any signs of vagal nerve stimulation, which can cause a drop in heart rate and blood pressure. If the patient experiences dizziness, lightheadedness, nausea, or vomiting, we stop the procedure immediately and notify the healthcare provider.
It's a good reminder that even seemingly simple procedures can have potential complications. Okay, let's switch gears a bit and talk about caring for patients with ostomies. This is an area where nurses play such a vital role in patient education and support.
Absolutely. Patients with ostomies face unique challenges, both physical and emotional, and we need to be equipped to address their needs in a really holistic way.
So let's break it down. What are the different types of ostomies, and what are the key things nurses need to know about caring for them?
Well, the two most common types are colostomies and ileostomies. A colostomy is an opening created in the colon, while an ileostomy is an opening created in the ileum, the last part of the small intestine. And the location of the ostomy will actually affect the consistency of the stool.
So a colostomy further down in the colon will produce more formed stool, while an ileostomy higher up will have more liquid output. Makes sense.
Exactly. And the type of ostomy will influence the type of appliance used to collect the stool. There are one-piece and two-piece appliances, and the choice often depends on the patient's needs and preferences.
And teaching patients how to change and empty their appliances is a big part of ostomy care, right?
It's essential. We want to empower patients to be as independent as possible. We need to teach them how to assess their stoma, choose the right appliance, and apply it correctly to prevent leaks and skin irritation.
I imagine it can be a lot to take in for patients. It's not just about the technical aspects of care, it's also about addressing those like emotional and social concerns.
You're so right. Many patients with ostomies struggle with body image issues, and they might worry about odor or leakage. It's our job to create a safe and supportive environment where they feel comfortable expressing those concerns.
And support groups and specialized ostomy nurses can be such incredible resources for patients, connecting them with others who understand what they're going through.
Absolutely. And don't forget about ongoing assessment. We need to regularly check the stoma for any signs of irritation, infection, or other complications. We also need to monitor the patient's output and make sure they're staying hydrated.
Well, we've covered an incredible amount of ground in this deep dive into bowel elimination, from the anatomy and physiology of the GI tract to the nursing interventions we use to promote regular bowel habits and manage those elimination issues. We've explored it all.
And we've delved into the, sensitive and sometimes challenging aspects of caring for patients with ostomies, emphasizing the importance of patient education, support, and really individualized care.
As nurses, we have such a crucial role in helping patients achieve optimal bowel function and maintain their dignity and quality of life.
So keep learning, keep asking questions, and never underestimate the impact you can have on your patient's well-being.
And that's a wrap on bowel elimination. Until next time, keep diving deep into this fascinating world of nursing.